85% of our patients are Hispanic, right? And so when you think about the diverse populations that we serve, one of the things we have to do is to meet those populations where they are, right? So we have to work real hard for language not to be a barrier. We have to work real hard for transportation not to be a barrier, because some of the things that have isolated and prevented certain communities from having access to great health care, we have to make sure that we eliminate those hurdles. And the cool thing is we have a lot of Spanish-speaking employees that work here, not just at the front desk, but we have Spanish-speaking providers in the primary care, in dentistry, as well as the pharmacy. I'm really excited and really proud about the fact that we can meet those diverse communities where they are.
That was one of the attractive things to me as well before I took the job. When I did a tour and I saw people that looked like me, I saw people that looked like my patients that I serve. And I think that makes the difference when you have a diverse population of people working to serve the people. There's a diverse population here in Forsyth County, and the patients that we serve come from different backgrounds, ethnicities. So to have people who understand you, people who know your language, people who can sit down and have a conversation with you and have an explanation, makes your service much easier to, provide, because I have someone that looks like me, they understand me. And a lot of people don't want to come into a place where they don't have anyone that looks like them or don't think that someone can understand. So it's all about our patient service, being able to provide care to those that really need it without any stigma, without any judgment. I look like you, okay, you understand me, you know my culture, you know my ethnicity. So just having a diverse population of people working gives you that multitude of services that you can provide to make the patient feel comfortable.
This is my first clinic for it being very diverse. I like how they have like iPads and stuff that has every language on there. I thought that was very different because everybody here is different. So I really do feel like this clinic is more like welcoming to the diverse, and they're more than open to bring their family and friends. Cause I see a lot of them, they'll come and then next week they bringing their sister, they got their aunts, they bringing everybody.
We definitely have the access when it comes to diversity for our patients. Like I said, we serve like the underserved, a lot of people that don't have insurance, but we also do accept all the insurances that they have right now. I feel like that's a big thing that a lot of people don't know. Just being in a community, that they don't know that type of service that we offer.
So we absolutely recognize that seeing patients in the language that they speak primarily is absolutely vital for good care. So all of our front desk staff all speak both English and Spanish. Many of our medical assistants also are bilingual. And then in terms of the clinic visit, since not all of our clinicians are bilingual, we use some interpreting software as well, where we have a live person on a video screen that can interpret.
So having a diverse group of workers here just help us with our mission in the community, because it's not just one group in this community. We have all the groups, and so we want to make sure we're connecting to our patients on a different level. Even with African Americans, I could speak to them more clearly than someone who's from Hispanic descent. And I say that because I have patients come in like, I don't want to take insulin. Why not? It's needle medicine. And so it's a stigma in the Black community about injecting drugs. And I'm like, no, this is gonna help minimize complications of your diabetes. All you have to do is this. There is no stigma around this. Nobody's judging you. Or somebody who has hypertension. Hey, don't put that piece of pork in your greens. Like helping them just navigate what I know, what we're eating. But you can't always do that if you're from a different culture. But that's why it's great to have a diverse group of people here.
What you have, how much money you have, none of that matters if you don't have good healthcare, right? If you're not healthy, if you're sick, none of that matters. And so if you want to empower a community, make sure they're healthy. Because once they are healthy, now they can make better choices. Once they have healthcare, or they have a place like United Health Centers to come, now they're empowered to take control of their healthcare, which translates to everything else, which translates to their opportunity to provide for their families, which translates to them building communities or building stronger communities, building stronger families. So I'm a firm believer that, you know, your health is your foundation. And once that health is intact, and more importantly, once you have really good options to improve your healthcare, then everything else falls in line.